In terms of timelines, we hoping to start the study during the course of June 2020, in the next week or so, hopefully. And then we're hoping to enroll the total number of 2,000 individuals, roughly in a period of about 8 weeks. This study is being done at a number of centers in Gauteng and possibly as well as the Western Cape. There will be at least between 6 to 8 different centers, where there are investigators that have got a rich history in terms of being able to conduct clinical trials of a very high standard, and that's the reason why these groups have been selected to participate in the study. So we're hoping to start enrolling as early as the middle of June, and then hopefully complete enrollment by the first or second week of August at the latest. After that, what needs to happen is that we need to follow up those individuals, right? And we're going to be planning on following up all of the individuals at least for 12 months, right? And that is to look at the safety of the vaccine at least until 12 months. But the main part of the follow-up is up until the time point when we get a predetermined number of people that have been infected with the virus in the community, right? And that magic number for us at this point in time is that once we've identified 42 cases of COVID-19 in these participants, at that time point, we'll be able to actually analyze the data to see if the vaccine works or not. So that number is 42. How long is it going to take to get to that 42 cases? We don't know, because it depends on a number of factors. But once once we've had 42 individuals that have been infected and that have developed COVID-19, at that time point, we'll be able to unblind the study, which means analyze the data to see if the vaccine works or not. In terms of what I expect as to when those numbers would be accrued, I suspect that we would probably accrue those numbers by October, November, because South Africa is still sort of very much in an upward trajectory in terms of this wave of the outbreak of COVID-19, and it's probably going to be, in Gauteng as an example, it's probably going to be about another 2 months before the epidemic peaks. In the Western Cape, they might peak in a month's time from now. But then even after that peak occurs, it's going to take another 6 weeks to 8 weeks for that wave to start subsiding. So I think we'll be able to probably get an answer as soon as November of this year.